Hi, I am Dr. Priyanka Mehta. Today, let's talk about scanty periods. I'm a gynecologist, and these days, many women come with the complaint that they have very light period, very scanty flow, there is hardly any period, or there is just spotting during her menstrual cycle. A normal menstrual cycle usually would last for 2 to 8 days, and a lady may change from 8 to 12 pads in the cycle at least. Of course, if the periods become very light and they are changing less pads or less using less tampon, or the amount of bleeding seems to be very less or the duration is shortened, then this is a scanty period. What could be the causes? The cause of scanty period, most commonly physiologically, there are some causes which are like the natural causes. Say when they just start their period, that is called menarche for young girls, or menopause when the period is going to end after the age of 40. Also, it can happen when you are feeding your baby, or if you have been using some contraceptive methods like the oral pills or injections, or even there is a special intrauterine device called Mirena. Of course, there could be some problematic or pathological causes of reduced bleeding, which can be because of various reasons. So, the most common cause nowadays is stress. Because of increased stress, the periods can become scanty. Then it could be when you are either following crash diet, not eating food regularly, or losing sudden amount of weight, over exercise. That also can cause a scanty period. Hormonal problems like problems with the thyroid, high prolactin levels, sometimes hormonal issues like polycystic ovary, and use of certain medications like even use of psychiatric medications can reduce your period flow. Problem can also be inside the uterus, where your endometrium lining inside the uterus can become very thin due to certain infections or due to repeated surgery like DNC, etc. Also, remember that nowadays we are seeing young women even as early as the age of 25 or 26 with very low ovarian reserve, which is tested by a blood test called AMH, and this ovarian reserve can lead on to a premature ovarian failure. So you need to meet your gynecologist if your periods have become very less or very scanty. They would do blood test like basic hormone test, FSH, LH. There is a test called AMH, anti-Mullerian hormone we are doing nowadays. Then test for thyroid, TSH, test for another hormone called prolactin. Also, a basic ultrasound will be done to rule out problems like polycystic ovary, to see how your lining inside the uterus is, thin endometrium, to see how your ovaries are, and is there any other problem which is causing the scanty periods. So, do meet your gynecologist, get the test done, and get evaluated if you're having scanty period. Also, avoid over vigorous exercise, avoid stress, avoid food which is excess in processed food and fat, and also sugar and salt. So take care, follow a regular exercise pattern, follow a good sleep cycle, need at least 7 to 8 hours of sleep, and hopefully you will find a solution to your problems. Thank you.